So today I had this very gregarious patient who came in. He's in his 60s. You can see on his skin that he takes care of himself. He takes particular attention in being in nature every day. He takes care of his eating habits. Surprise, surprise, when we look at the x-ray, I could see this huge abscess around this tooth and around 4 elements bridge. Literally moves 4 or 5 millimeters. And he told me that he had these teeth replaced with dental bridge a few years ago, and ever since it keeps falling off. So every time he has to go to the dentist and they put back the bridge, and then 1 year afterwards it falls off. But the situation is quite sad. All this here is about 1.5 centimeters wide, which is infected. And I know he told me he does lots of stuff for his mouth. He's been using essential oils, he's been doing oil pulling, and also using ozonated water to disinfect. But still, because this is in the bone, he doesn't have access to clean. And that's not all. You can see he had multiple teeth extracted. He has lots of crowns, which are actually some ceramo-metallic crowns. And if you look closer on the x-ray, this is his left sinus, and you have this big spot over here, which basically is a huge infection, taking almost 3/4 of his sinus. Usually you should see something like here. We have the membrane, which is around 1 to 2 millimeters. And here we have almost no space left in his sinus. And you can see right down here, there's a root canal treated tooth with an infection here and some paste, filling paste, which went into the sinus. And I'm guessing this is the cause of the big inflammation he has. Here we can see the bridge, the 4 elements bridge, and we can clearly see he doesn't really have any contacts on this side, a few contacts over here, and the bridge touches. So of course the bridge is going to keep falling off because the contacts aren't okay. When I took a look at the crowns he had in mouth, around every crown he had this type of inflammation, which is very typical to people which have allergies to metals, and especially to nickel, which is a common metal we found in the dental crowns. So clearly this is going to have to be removed. We're going to have to remove his bridge, take care of his infections, take care of his sinus issue, put him in a secure state so there's no more infection, no more bacteria running around in his bloodstream, and then see how we can fix the way the teeth bite together and also the missing teeth.